Welcome, listener, to Lost and Searching. Today we're speaking to Tanya Marwaha. Tanya is a founder, a multi-award winning speaker, and a consultant across mental health, suicide prevention, and disability. Today's conversation, I can't lie to you, is a little bit of a challenging one emotionally, and I guess this is where you'd put in a hashtag trigger warning. But in all honesty, we do discuss some challenging topics. We discuss, to be upfront with you, suicide attempts, suicidal ideation, various disabilities, the challenges that this creates, and mental health impacts. And we think it's really important to be able to openly talk about these things so that we can raise awareness, so that we can encourage honesty, and we can encourage folks getting the support that they need when and where they can. It's really important to me personally, as well as that, to be able to understand that the future leaders we're going to have, and indeed many of the current ones, might be suffering with one of these things, whether it is silently suffering with something mental health related or some kind of challenge such as the disability that either exists in and of itself or even comes about because of some of these mental health challenges. And be really honest about the way we might need to be showing up or thinking about certain things to help overcome these challenges and potentially even grow through them. So with all of that being said, thank you so much for being a part of this very important conversation. Let's get into it, and welcome to the show. Anyway, perfectionism. It's a weird one because I think we logically know that it's strange and or that it's annoying and that it doesn't really make sense, but we still have some of it anyway. I say many folks have, I think, challenges with perfectionism, and it might be a case of understanding what perfectionism actually means to you. Like when you think about perfect and or your own perfectionism, what comes to mind? What are you thinking about? What are you feeling?
I've done a lot of deep delving into myself to understand exactly what this is. And for me, it's the fear of like judgment, fear of failure. A lot of it's external rather than internal. But I think also I realized I have a very skewed sense of self in the sense of like, if I feel like someone else is doing the same thing, 100% go for it. So deserving, so worth it. You have 0 followers, it's fine. Like I'm here, I'm rooting on for you. But where it's me, I'm like, but you're already inferior. So like, why are you even trying? Why are you doing this? My like self-talk is so negative. So I think that comparison and imposter syndrome for me is very rooted in things I've experienced when I was younger. That feeling of being inferior, I think is what it is for me.
Speaking of when we're younger, where do you think that comes from for you?
Good question. Oh, tough. It's a tough question.
I know you talk very openly about this stuff, and I do too, so
Yeah.
we're going to get deep into it today, but if you ever don't want to answer something, just let me know.
Yeah, no, sure. I mean, this is something particularly the last couple of weeks I've been journaling about, thinking about. So I grew up in Worthing, which is near Brighton, predominantly white area. So I remember being at school, I was the only person of colour. So I immediately kind of stood out, and that impacted a lot of my experiences. I experienced a lot of racism in particular. And I think those experiences, comments that were made, conversations, behaviours, instilled this sense of inferiority within me. And then when I think about kind of being at home, I'm the middle child. And I was always a very easy child in the sense of like my parents didn't have to worry about me. Like Tanya just always does the right thing. She does everything. So,
Classic middle child. I say that as if I have any idea. I don't. I'm an only child. But anyway, okay. Talk to me about
so
it.
I think I took pride in the fact that I was the easy one. I was, doing everything right. I pleased everyone, a big people pleaser, by the way. So I think all of these things contributed to me feeling like my worth is dependent on what I offer. And even then, when I was offering a lot, whether that was in social circles, at school, in friendship groups, I was automatically still inferior. So I've always viewed other people on a pedestal. Like, it doesn't matter who you are. You could be a stranger walking down the street. You're automatically on a pedestal. And then I just down talk myself.
What is human value?
Human value is what you make human value to be for yourself. I think everyone values themselves in different ways for different reasons. And I think it's all about finding what it is that you want to be valued for and what is the right way for you to expect other people to value you. Like, for me, learning about what my value means to me is that it doesn't need to matter about what I bring to the table. I just have that value for just being me, for just existing. That is something I definitely didn't think when I was younger. And in terms of how I want other people to value me, I want other people to value me for the experiences, the openness, the transparency, talking about these things that we don't speak about. So I think it's just exploring what that means for you and how you feel most comfortable with it. Because oftentimes when we label a value to ourselves, trying to achieve that value can be detrimental.
This is actually really timely for me. I'm going to call out a friend of mine, but we're not going to use his name. We went on a trip to Spain a few months ago, and a close friend of mine, for him, it was almost like a dual trip because his girlfriend lives out there. And he was like, my boys and my girlfriend, we're all going to be hanging out. You're all going to meet each other. And so he put a lot of pressure on him. And he was constantly worried about if he was doing the right thing, if he was adding enough value. He'd get really impatient and try to rush us around from destination to destination. We would want to just enjoy the journey, that kind of thing. And I caught him for a moment. I say a moment. We had a chat. We went to get some dinner together, just the two of us, and I was having a chat with him and brought these things up to him, and he said something very specific to me, which I've heard from a lot of younger people. I probably said it myself, and it also sounds very similar to some stuff you were just bringing up, which is like, I do all this stuff because I want to be valuable. I want to make sure I'm adding value.
Yeah.
And my response to him was, I promise you, you add enough value by just being.
Mm-hmm. I love that.
The challenge this creates for us, though, is if we don't have an answer to what is human value, what is my value, what is the value that someone else brings into my life, if we don't have that, or we don't know what that is, we haven't thought about it before, there's no benchmark. So there's an assumption that I'm not good enough no matter what I do because I have not set a benchmark for what good enough is. What is good enough to you?
Good enough for me is doing the things that make me happy and doing them because I truly want to do them rather than because I think I should do them. And for me, doing that is just enough. It's good enough. It's more than enough, actually. Because before, my good enough was based off of, oh, what do other people think it's enough? And then you're just chasing other people's expectations, other people's perceptions. And
how do you even know what those are?
You don't, because a lot of the times you've actually created them in your own mind.
Exactly.
So it's just, you're just going to be chasing nothing.
Part of your story is growing up in that kind of environment you described. Part of it is you grew up with a number of challenges that folks around you, even from those backgrounds, didn't understand. You do a lot of work around disability advocacy as well as the DEI advocacy. Talk to me about your story. What is your story? How did we get to sitting across from each other in these chairs and the things you are and want to be contributing to the world?
Good question. So my story started from day dot. I mean, I only remember so far, but it started since I was here. And I think my entire essence, growing up especially, I remember just looking out the window thinking like, why am I here? Why am I me? Like, why am like, do you ever just get stuck in your head of like,
Interesting. How old were you?
like literally, I remember being like 3, 4 years old.
Why am I here and why am I me?
Like I'll just look outside at the sky, and when you like focus and you can see the clouds moving, and I just think like, why is the voice in my head mine? Why am I me? Why was I born here? Why do I have this family?
Oh, that's fascinating. That's a very wise thought to be having. But I have noticed as I've gotten older, children are very wise. But anyway, that's really interesting. Okay.
So I just always used to have these like bigger questions about life. And I think a lot of the time I felt like I was here to serve a purpose, and that purpose was to function in the roles that I had felt that was set for me, but also I had carved out for myself. So I wanted to be the good daughter, the one who excelled in academics, became a lawyer, made my parents proud, made lots of money. My parents could then tell family back home in India, like, oh, she's a lawyer. This is great. I wanted to fulfill their dreams, the dreams that they didn't get to live for themselves. I wanted to be liked. I wanted to be valued. I wanted to be loved by other people. And I've always been a huge people pleaser. I think even at home, I was the peacekeeper, the one who wanted to fix problems, find a solution. I wanted to be helpful. That was the value I felt like I could bring. Always helping other people, always solving problems. And then I think when I kind of continued going on through life, I really struggled with my own kind of the conversations I was having in my head. That bigger question around like, who am I? Why am I here? Slowly started to develop into a bit more of a negative question. So like, why am I here? I don't want to be here. Why am I here? And that negative self-talk came in, comparison. I had very, very low self-esteem. And then when I was around 12, 13 years old, we started to experience quite a lot of bereavement on my father's side of the family. And that ended up being something that went on for around 5, 6 years. Actually, we lost multiple close family members on my dad's side of the family. And then again, those questions popped up, but those questions popped up in a different matter of like, what is the point of being here if people are going to go? Like, how do you deal with loss and all of these things? And I had already been struggling with those negative thoughts, and that quickly changed into suicidal ideation. And I remember being 13 years old thinking, I'm doing well at school, like everything's fine on the external. I can't go to my parents and say, this is what I'm thinking and feeling in my mind. And then my own mind just became a jail. Like I was just stuck in it all the time. And I was 13 when I had my first suicide attempt. And I just remember thinking, like, oh, that didn't work. Like, you're so stupid. Why did you do that? And then thinking about, oh, well, I can't let anyone know because they're going to be so disappointed in me. And then I'm not living up to the expectation and the roles that I should have. And I just turned up to school the next day, and I was just sitting there in class thinking, I was looking at everyone thinking, like, genuinely, we have no idea what's going on in someone's mind. Isn't that scary? Because like everyone's sitting here thinking, oh, she's completely fine. She's just the quiet one who gets on with things, but they have no idea what I'm thinking, how I'm feeling. And at the same time, I started to struggle with my physical health. So that translated into like body pains, headaches, stomach aches. And my parents were rightly concerned, and they kept taking me to doctors. The doctors had multiple different reasons. It was growing pains. Someone told me once that like the cartilage on my knees has grown weirdly. It was stress. Stress was a big one. They were like, oh, what year are you in? And I'll be like, I'm year 9. And they'll be like, well, then you have your GCSEs coming up soon. You need to make your options. Like, it's probably that. So I then had every single experience invalidated and feeling even more alone because no one actually was truly understanding what I was dealing with. But then also knowing that I had to mask because I had to just keep on going. Like, unless something could significantly change, I had to be on the path that I was on, which was do really, really well at school, get a scholarship, go to university, become a lawyer, fulfill that dream. And then my mental health just kept on getting worse. I continued to struggle with suicidal ideation and suicidal attempts. And it was only when my behavior, I think, really started to change with other people. So especially at home, they were like, you're very angry all the time, aggressive, irritated. You're just not the same person that we used to know. So it was only when it got to that point where I felt like I was forced to actually about what was going on, then that's when I saw the doctor, and that was a bit of a back and forth as well because they just didn't believe me. And then I got diagnosed with anxiety and depression. At this point of time, they still had no idea what was going on with the physical health either. So they were treating things in isolation. So no matter how much therapy they gave me for my mental health, it didn't solve the fact that they just didn't have any idea what was going on with my physical health. That continued until I was at university. And then in my second year of university, I got diagnosed with a physical health condition. So it took 7 years to get that diagnosis of fibromyalgia and Ehlers-Danlos syndrome, which are in essence, so one of them is a connective tissue disorder, the other one is a complex chronic pain condition. And I genuinely thought that once I get those diagnoses, my life is going to be so much better. I thought that all my mental health challenges were just going to go because I had put all of this worth and weight and value on just those labels. And when I got them, I was like, oh, now I'm just on a 2-year waiting list for pain management. They just told me there's nothing they can do about it. This doesn't do anything other than give me something to tell people when they ask me what's wrong with me, or help me fill out my extenuating circumstances forms at university. That's literally it. And that was my most recent suicide attempt at 19. And at that point was when I think I was just so overwhelmed. And I remember my parents being like, I'm sorry, but like, what is it that we can do to help? They just wanted to help. And I remember I ended up seeing the mental health nurse a week after my suicide attempt. And she was like, well, you seem like you're doing better. There's nothing really we can do. If you ever feel like that again, just call 111 or speak to your GP. And I came out of that thinking, to what extent does someone have to go to prove that they're feeling like that to get the support that they need? Because I felt like I'd exhausted all options and I still wasn't getting the support that I needed. So that's when I guess things changed, and that's what brought me onto this path. And I just started to use my experiences to do as much as I possibly can.
At 13, before that first attempt, what's going through your mind? What are the thoughts? What are the processes? What are the conclusions upon reflection?
I think I was just exhausted mentally, exhausted physically. I didn't want to get up every single day and just perform. I felt like I was performing. Life just sometimes felt like this, like musical, and I just had to rock up every single day and just perform, and then I would get home and still have to perform. And the only time I didn't have to perform was when I was trying to go to sleep. And that meant I didn't sleep because I was trying to be myself. So I think I was just exhausted at that point of time. And I think I was just looking for any escape, any way to change reality for me, which I think is what led to me thinking that that was the option for me.
Yeah, I've heard this from suicide prevention experts like yourself before, this element of control. Sometimes if you can't control your life and that life feels like it's controlling you, the only control you can take is over whatever control you feel like you can take.
Yeah. Yeah. And I think also there's a part of you which wants people to understand what you're dealing with and how serious it is and how deep it goes. And sometimes, unfortunately, we live in a world where it's only after actions like that that people may start to take you seriously or may try to understand. And the reason why I'm saying may is because a lot of people actually don't. So I think after the first attempt, definitely like my mindset became like, people are only going to ever understand when I'm not here. Like I'm more valued and I'm more worthy when I'm not here versus when I am here.
This is an interesting thing to be talking about for me, because for most of my life I had not come to terms with the things I had experienced with my own, like, and I wonder to what extent this is stereotypes around, or the narrative around men specifically, or if it's the family I had, which was very like stereotypically Arab. We don't talk about things, but not on purpose. It was just like, if I ever cried, my grandma was like, "Stop being such a baby." It was like that kind of narrative. But for a long time, I didn't talk about a lot of things, and so reflecting a little bit on my own journey is a little bit like just how many people I've worked with who have been in these kind of situations that you're describing, or I've been in rooms or talks where, experts are describing this sense of this prison cell or the sense of this needing to take control. and attempts, like my own attempts, and even almost forgetting that I've done them, because as I got older and I got happier and healthier, almost like erasing that past, but it's there. Do you know what I mean? Like, it's no matter, and the point is to get healthier, the point is to get better, but then we don't talk about, and we almost start to pretend these challenges don't exist, because they might not exist right now, which is great, but they existed, and they existed for a reason. And understanding that reason helps us prevent it happening again in the future, not just for ourselves, but for others. But we're still so afraid to talk about these things. Why? Why do you think these are conversations people do not like to have? Aside from the obvious, right? It's painful, we might be talking about death, it's heavy. For some people, it's challenging to process, right? But what do you think is the unspoken barrier between general society and understanding these challenges more? What do you think would have made a difference to you at 13?
So I think there's a couple of different answers to that question. So as you said,
I've asked like 5, so that's my bad.
There's a general discomfort around having a conversation that's uncomfortable. That's one, right? What you said about painful, etc. There's then the layer of cultural context. So that's not just in terms of like ethnic culture, that's culture of society, generations, the norms that you're brought up with, whether you should or you shouldn't speak about these things, the consequences of these topics. So if it brings shame, reputation risk, weakness, how it's perceived, for example. And then I think there's this other layer that a lot of people don't actually speak about, is the fact that having these conversations puts a mirror up in front of your own face. And by that I mean is that so the way I like to explain this is oftentimes the things that actually make us the most uncomfortable are things that we resonate with at some level, but maybe we don't actually realize that we resonate with them. Because oftentimes we think, is your experience what you're talking about directly relatable to me? No, then you think, oh, it's got nothing to do with me. But there's always elements of it, elements of that story that are transferable to your own story, your own wounds, the things that you keep inside of you. And I think oftentimes it's just easier to just push that mirror away and say, you know what, I don't want to speak about it. I don't want to speak about it because it's not relevant to me. But actually the reason why you're saying that might actually be just because it is really relevant to you. And I think it's only when people take the time to stop, reflect, and actually understand, like, what is the barrier that's holding them back? Oftentimes that barrier is internal rather than external.
What do you think most commonly holds us back?
I think, like you said, right, that you just erase things, like things that have happened in the past. You think, well, it's not like that anymore. I don't need to think about that. I've grown from that. I'm healed from that. So you block it out, you compartmentalize it. You don't want to think about it. You don't want to talk about it. You think it's kind of chapter closed, done and dusted. And I think having to revisit that for a lot of people is the obstacle, is the barrier. They try to avoid it because they don't want to revisit it. But actually revisiting it oftentimes helps you understand that the impact that something in the past, something you think that's done and dusted, is actually still having on you today.
Because relapse is a very real thing in these kind of situations, isn't it?
Yeah. Yeah, because I mean, I hate it when people say, oh, so have you recovered from your suicidal ideation? Have you recovered from your anxiety? Have you recovered from your depression?
Like it's a cold.
Yeah, and I'm like, no, I'm managing it. I'm learning to live with it. And I know that it's inevitable that I'm going to have episodes where it's extremely bad again. And I have been having those. Does that mean I'm recovered? No. It just means that I'm learning to accept and live with it in the best way. And I just find it so toxic that people nowadays in the mental health space especially talk about how I overcame depression, how I overcame anxiety. And I'm like, you can't overcome those. It's not a point in time that you never truly revisit. It could be that you had experiences where you were feeling like you may be anxious or you were feeling like you may be depressed. If you're talking about things like clinical depression, like I'm no doctor, but from my own experience at least, it's not something that I've recovered from, and that's it. I'm never going to experience it again.
It's a retelling of the story you have experienced, where when you were 13, it was, oh, she's just a quiet one. And now you're an adult and you're doing your thing. You're out here, like, changing your corner of the world. And it's like, oh, she seems fine and she has it together. And it's the external labeling again, right? Does that ever get frustrating?
100%. I mean,
It sounds like a dumb question when I say it out loud. But
so many people think that, oh, because you are confidently speaking about your own lived experience, you're speaking about suicide prevention, you're doing work in this space, that these things don't bother you. Like, no, actually, for the longest, I was doing suicide prevention work for a year. The most intensive year I've had working in suicide prevention was also the year that I was struggling with suicidal ideation again, after having not had that for a year and a half. And people think, well, then why do you do it? And I'm like, because there's a connection to it and there's a passion and I want to change things. But that doesn't make it any easier. It doesn't mean I'm a new person and I've come to speak about this from a different perspective. No, it's just I'm living it. I'm living it, and that's why I'm sharing it.
I'm willing to bet it's exactly that, is it fuels you further. It's like, why are you still doing it when it's a challenge for you? It's like, it's because it's a challenge for me. But you're taking, or I should say, and you're taking ownership of that challenge. So it's not a challenge and you're a victim of that challenge. It's a challenge and it was an opportunity for you to learn about it so you can pass on some of that learning and the empathy to others. That's what it sounds like anyways. So that makes it a really empowering place to be. It doesn't mean that the challenge is going to immediately dissipate. And so you have, over the years, going back to your story, a number of these times arise, and it's almost like the concept of the wave. The wave peaks and it troughs and it peaks and it troughs. When each of those waves started to go back down, things got a little bit easier. What was going through your mind then? What did life start to look like when things got easier? Was there anything that you were doing for yourself during the times that things got better that helped you navigate?
The first and foremost was, how do I help myself prevent this from getting that bad again?
Okay. When did you start thinking that?
I think when I had gone through my most recent suicide attempt at 19, and that's when I started doing this work, and when things started to get better, is when I thought, the thing I need to focus on right now is, how do I get myself into a position that when this gets bad again, because I know it will get bad again, I will be able to manage it. I will know my support systems. I know who is there to support me, how to get that support, and where my boundaries lie as well. So actually defining, like, what does it look like when it starts to get bad? How do I notice? Who do I need to speak to? How do I need to get the support that I get? Because oftentimes when you're passionate about something, you keep on going. So I know that, for example, the times that I've poured the most into my suicide prevention, mental health awareness work has been actually when I've been struggling the most, because it feels like I'm doing something positive. I'm channeling it in a positive way. But actually now I've gotten to a point where when I start to get hyperfixated and I'm losing sleep over it, my mind is just all consumed about it. I have to stop and question myself, like, is there something going on here? Is there a reason why I'm behaving in this way? So I think for me, the most important thing when things start to get better is just understanding, like, what are the lessons that I've learned? Like, what is it that might be the signs that I need to check in with myself? What are the things that do help me get to a more stable point, and what are the things that don't? Because sometimes actually, like, as life changes, people change in your life, circumstances change, you have to kind of reevaluate at each point, especially with something like mental health, where other people's behaviors, other people's kind of interactions with you during that point of time where it is so bad, are really important to take account of, because it might be something that you want to move away from in the future.
What were some of those, or are some of those signs for you? What are those things you're most aware of, and how do you recommend others look for what those are for themselves?
So for me personally, when I start to get like all consumed by something, hyper fixated
And this is on anything.
on anything, it could be Netflix. Oh yeah, like the last couple of months, I was like, my Netflix screen time has gone up. What's going on?
Okay.
It could be that. It could be work for me. Like anything career related is a huge thing that I get into. Um, I remember when I was younger, which I can now look back in hindsight, like fangirling. That was like a huge escapism. So I think when I find that I'm hyperfixating or consumed by something that I just can't stop. I don't have the boundaries in place. That's the big one. I take a lot of notice of how other people observe my behavior changing, because that's something I find very helpful actually. Like my family, the people who I speak to on a day-to-day basis, sometimes they do say like, are you sure you're okay? Like you've been kind of, this is what I've been observed. Before in the past I'd say, oh, just leave me alone. That's so annoying. But actually now I'm like, this is helpful. Talk to me a little bit more. Like, when did you notice that? For me to then go back and reflect on that independently. And then my body, I can't stress enough how your physical body can show signs when you're struggling with your mental health. So for me, like if my sleep pattern starts to get disrupted, if I'm waking up multiple times, if I'm waking up feeling anxious, especially, that's the big one. When I feel tired, no matter what I'm doing, no matter how much I rest, that's another big one. Headaches, just anything that makes me feel achy, lethargic, that tends to be a sign to me that, is there stress that I'm starting to internalize? Is there things going on in my mind that I'm choosing not to pay attention to, that actually I do need to pay attention to? So I think my advice for other people when it comes to finding out what the signs look like for them are observing. I think a lot of the times you need to go into a third person perspective and observe yourself. Observe what changes when you start to feel negative or when you start to feel like you're getting better, and also leaning on other people as well to help you work that out, because oftentimes we try to set up a perception for ourselves, this is what it looks like and this is what it doesn't look like, but other times people can say, actually I noticed this about you.
It requires a lot of empathy in a weird way to be able to empathize with yourself. Like, this is kind of where we started the conversation, actually, is like treating yourself the way you want and think others should be treated. And for folks like us who did a lot of people pleasing, like I totally get what you're describing there around people pleasing. We're super harsh on ourselves and we are much more forgiving of others. At least that's the baseline default, right? And so weirdly, it's a space of needing to be empathetic towards ourselves. This third positioning of step out of yourself and view that person over there, yourself, as another person. What would you want them to do? What would you want to give them? When I'm going through clients that I coach, some of our like some NLP practices. So I'm an NLP coach practitioner, and we have a lot of these kind of, imagine that person over there. What would you give them? Imagine that you over there. What are they doing? What do they look like? And it's strange to do that with people because sometimes people go, oh, this person that is me when I'm here is different to that person that is me over there. Yeah. And the bridge that is empathy towards yourself can be applicable in the same way that empathy towards others can be applicable.
Yeah, yeah, 100%. And so there's that external person perspective. The other thing that has been really helpful for me is finding pictures of myself when I was younger.
Oh, interesting.
Like 3, 4, 5 years old, a child, and I look at her and I say, how would I want her to feel? How would I want to treat her? What the things that I would want to say to her? Because I think all of these things I spoke about, observing yourself, observing what it looks like when it gets bad, that can lead to feelings of frustration, anger towards yourself. So if you're not leading with empathy and compassion when you're working with yourself, then it's not helpful. So I try to just look at her and think, what is it that I would want to give her? Like, what is it that I would want to do for her? Because I can look at myself and feel negative emotions and have negative thoughts. But when I see like a baby me, I'm like, she didn't know what she was getting into. She didn't know what was going to happen. She was going through societal conditioning, but like, who is she inside? And everyone talks a lot about like inner child and diving into that. And it sounds very cliche, and I think social media has made it a bit of a buzzword. But for me, like doing that small exercise in myself has helped a lot.
And you also start to develop around this time, kind of, let's call it in the middle between 13 and now, really roughly in the middle of that story. Your kind of chronic illnesses and other physical health challenges, things like that. Upon reflection now, being older, more experienced, more researched, working with other people on these things, how linked do you think those things are or were to your mental health?
100% linked. I mean, when I got that diagnosis, the doctor asked me, when did these symptoms start to come up for you? And I said, around this point in my life. He was like, what was going on? And I said, well, we dealt with bereavement. I think I was just very anxious. Even as a child, everyone says I was very anxious, very sensitive. And he was like, well, do some reading into it, because a lot of people, it's a very, fibromyalgia especially, it's a very under-researched condition. There's more research in the States than there is in the UK. So a lot of actually medical professionals don't know about it, so they don't know how to approach it. Because he said there is some research trying to explore the link between trauma and the onset of fibromyalgia. And when I started to do that research, it actually just reaffirmed the mind and body link so much more than I had ever thought of. Because actually, the thing that's helping me manage my physical health symptoms since getting that diagnosis has been focusing on my mental health and focusing on all the things that had happened in the past that I just bottled up within me and, of course, manifested physically for me.
So, talk to us more about the fibromyalgia. Again, if it's under research, most of us probably don't actually know much about it, myself included. So, talk to us more about what it actually is, what those symptoms are that manifest, and then how working on the mental health has impacted those symptoms or the way that manifests.
So, fibromyalgia is a complex chronic pain condition. Whenever someone says to me, how do you explain it? I'm like, pain everywhere and anywhere, basically. So when they do test for it, it's a process of elimination. They have to eliminate through bloods, through scans, things like rheumatoid arthritis and all of those other conditions. Fibromyalgia is more like a last resort, usually, that they can't find anything on a scan or a blood test. This is probably what it is. And they test it by, there's like 22 points on the body. And I think when you mark a certain amount, if you reach that threshold, then they say, okay, it's fibromyalgia. And it's really hard to explain because over the years, I've had so many symptoms. Like, for example, like I always have really bad right eye pain. It hurts all the time. I do wear glasses, but every time I go to the opticians, they're like, your eyesight's fine. It's the same as it was before. Oh, they go to the doctors. Well, it's probably fibromyalgia. Fibromyalgia impacts everything. I have like leg ache. Oh, it's fibromyalgia. It could be anything. We just don't know. So that's the hard thing, is that when no one knows the answers, and it's just huge thing, fibromyalgia, like, what does that mean? What do I do about it?
It doesn't sound like a diagnosis so much as a catch-all term that's been defaulted to.
Yeah, and the thing is that when you do get diagnosed, we get referred to pain management. I got diagnosed in 2021. We're in 2024 right now. I still haven't seen pain management. Yeah.
So as in your doctor referred you on and they went, cool, put you on a list, and you're still on that list.
Yeah, so I got diagnosed January 2021, but I was actually referred to pain management in November 2020 because they were like, we can still refer you without a diagnosis. So when I went January 2021 and got that diagnosis, he was like, I will push that referral forward if I can. Still waiting. Haven't heard anything.
So did it get pushed, or?
Yeah, I mean, I've rang up so many times.
And it's just so long. The
Yeah.
list is basically just so long.
I've rang up so many times over the years and I've said, I got referred. I've been to the GP especially to say, like, where is this referral? And they're like, your name is there, but we can't tell you how long it's going to take. So from what I've heard about what pain management, so my sister is, she's doing medicine. So a lot of what she learns around is around pain management. And she was like, oh, you do realize a lot of pain management appointments are actually around like reframing how you perceive your chronic illness. Understanding a lot about kind of your emotions, your mental health, is a lot about what they do in pain management. So when I've looked at lots of different resources, a lot of it's around like your self-worth and how you perceive your illnesses and how you therefore perceive the value of yourself. I think the biggest thing when you live with any chronic illness or disability is the biggest thing that can actually have an impact on your mental health is how you feel like other people therefore value you now that you have this, but also how you value yourself. So growing up, I felt like I needed to be like having a big advantage in every single area of my life. As soon as I started to struggle with my physical health and my mental health, I just automatically perceived like the health section as like having a deficit. So I then tried to overcompensate in other areas of my life, so education, then on to career. And for me and for a lot of people I speak to who have disabilities or chronic illnesses, it's around seeing yourself as still valuable and worthy despite the conditions that you live with. So I think for me, when I say that things have been helpful with managing my pain and fatigue, it's around how I perceive it. I don't get annoyed at my body or get angry at my body when it has a flare up. Like right now, if you see I keep moving around, it's because things hurt, but I'm not getting annoyed at myself. I'm just accepting and being compassionate. So leading with compassion for myself not just helps my physical pain, but my mental well-being as well.
When I was learning NLP, we had this really interesting conversation about pain management specifically, because if we have this, the concept, the idea is that everything that is perceived by our brain is, or everything that is processed by our brain, I should say, perceived is absolutely the wrong word. Everything that is processed by our brain is done via neural pathways in our brain that trigger different nodes, basically, which trigger thoughts, feelings, chemical releases in and of themselves. And so the pathways that are taken in the brain, how quickly they get there, what other associations, all of these are important, and it's all training and retraining. So the fastest and most powerful way to do this is through language. An interesting fact about the brain is that the brain cannot think in negatives. So I'm sure you've heard this, is a bit cliche now, but I'm sure you've heard this before. But I'm gonna give you and all the listeners at home a challenge. So everybody, I would like you to do me a huge favor and not think about a flying pink elephant with rainbow wings. Don't think about it. Don't do it. Have you done it?
Yeah.
You failed. It's awful. No, I'm kidding. The reason why our brain has to think of the thing is because we have to think of the thing to tell ourselves not to think of the thing. The brain actually can't work in negatives. It can only think in a positive and then tell itself to what to do with that thing it's thought about. So when we talk about pain management, that in itself are two words that makes an enormous number of assumptions. That doesn't necessarily help the brain. So the brain is now thinking, I'm gonna have pain. I'm gonna have to manage it. The pain can't be overcome. It's not reduction. I'm not going towards a positive. So it's not called, I don't know, peace therapy or whatever. I don't know. It sounds silly, but I think you get my point, is where we've labeled it an anti-negative as opposed to a pro-positive. And so immediately we're setting this space up. We're setting people in this space up for, at best, extra challenge, and at worst, failure. And so I wonder if an alternative, which it sounds like is what you've done, where you almost took your fate into your own hands and you didn't rely on quote unquote pain management people and instead said, what do I want instead? Almost served you in a way. It's not necessarily an excuse for the lack of support, but in a weird roundabout way, it gave you the opportunity to understand what you needed without labels necessarily needing to get in your way. Does that make sense? Like, to what extent do you feel like you took your life into your own hands, and what is trying to do that or doing that taught you?
100%. I mean, the path that I'm on now, which is where I use the darkest moments of my life to shape everything that I do on a day-to-day basis. I 100% took my life in my own hands because I just felt like, well, everyone else has failed me. Everything else has failed me. I have to make something out of this myself. And for me, making something out of this was just about sharing it and being vocal about it and seeing where it would take me. The thing that I knew the most I wanted to do was to help people and make sure that other people don't feel alone, because that's exactly how I felt. And I think what it's taught me is understanding that I don't need to wait for other people or wait for situations in my life for me to take control and for me to do the things and behave in ways that fulfill me. I think I had always been waiting for just things to come to me, the right things to come to me. I had this trust, but I was waiting. When I was waiting, I felt like I was at the mercy of having to just be patient and get by until these things happened to me or these people came to me. And that's how I felt a lot of the time when I was younger as well. I had to wait for my grades to validate me. I had to wait for doctors to come and give me what I needed. But actually I was like, wait, I can just give myself what I need. And to be honest, I didn't even know what I needed. So I had to go through the exercise of defining what I need to then know what to give myself.
This is so empowering and freeing in a way. Comparing what you just described to the beginning of this conversation and the story where you felt like you didn't have control, you needed to take control, you felt like you were in a bit of a jail cell, totally different language from actually, I'm in control, I'm taking control in a healthier way, I'm in charge of my own destiny, I'm not in the prison, I don't need to wait for anyone else. It's the difference between making opportunities and taking opportunities. The mindset of finding places, any little space to make an opportunity for yourself sounds so empowering. And what change has that led to in your life?
The change is that I don't feel miserable like in everything that I do. The change is that it's helped me understand what my own worth means to me and what that looks like. It's helped me understand what it is that isn't good for my mental health and what is good for my mental health. It feels almost like I'm writing the story of my life at a later point than I should be. It feels like I'm trying to unlearn all of these things that I had learned and trying to build something from scratch.
Well, that begs the question, when should you be writing the story of your life?
I think it's different for each and every one, isn't it? And I think for me personally, I think it came at a younger age than perhaps when I look at some of my peers, which is completely okay. I think at one point I did think like, oh, we should be, we should have access to all of these things. This is what education should be. It should be writing these narratives for yourself. It should be defining who you are before even being taught any of this external stuff. But then when I thought about it, I was like, actually, what is the catalyst for all of this? The catalyst is life experiences. You're only going to experience certain things in your life at a certain point of time. So I think the beauty in it is actually that it happens at a different time for every single person. And the way it happens is different. The time it happens is different. And what that then goes on to lead on to is very different.
As a result of these experiences, you go on to start an organization of your own. Was this after that last suicide attempt you mentioned? This is after 19-ish. You started an org of your own to try to do some of that helping. Yeah. Talk to me about that. What was that like? What was it like trying to share your story with other people? And did it teach you anything further about yourself?
Yeah, definitely. So I started writing a blog before I had got my diagnosis of the physical health. I started writing a blog. That was the most scariest thing I've ever done. Because I was like,
interesting. Okay.
I'd always loved writing, but I had gotten to a point where I was like, there's nothing more frustrating than when someone asks me like, wait, what is wrong with you? And I was like, I don't know how to explain because I don't actually know what's wrong with me. So I started to write the blog in a way of explaining myself without having to verbally explain myself. So I was just like, I was at university. It was my first year in university, and I was like, meeting so many people, and I can't explain it. I don't want to explain it every single time. So if I post it on social media, maybe they'll see it. And the response to that was so many people saying, thanks so much for sharing. I resonate with this, or this is actually really helpful. And I had never thought about doing the same in terms of the mental health stuff until after my attempt, where I just felt so frustrated, so helpless. Like I said, I had seen that nurse and she was like, well, just call 111 or speak to a GP if you feel like that again. And I was just like, once again, it came to the point of like, why am I waiting for other people to help me? What is it that I can do to help myself? And what is it that I can do to hopefully help other people? So I just started an Instagram page, and I literally remember going on YouTube and searching in like how to create graphic design graphics, because I'd always seen people make like infographics on social media, and I was like, that's so cool. I don't know how to do that. And I watched a tutorial on Canva, and I was like, okay, let's just get started. Found some statistics around youth mental health in the UK at the time, started to post those, created some content around strategies that have helped me with my mental health. I just wanted to raise awareness around it. And then quite a lot of young people started messaging on that Instagram account saying that they resonated, they were really struggling with their mental health. They wanted to create resources and content, how to do it. And I thought, oh, well, I kind of need to give this a name. I need to figure out what this looks like. How do I manage people? What does this mean for me? I was still studying at the time. So then organically just created a team. We just started to create content, started a podcast, really, really informal, just recorded it on Zoom and put it on Spotify and Apple Podcasts. And then other organizations and charities started reaching out, and they were saying, oh, we love the work that you're doing in youth mental health. Like, can you help us shape our children's and young people's mental health strategy? Can you provide resources and content for us? And then at every point I was like, this was just an idea off the whim. Like, what do I do? Does this need to be an organization? Does it need a logo, a website? So I was really just learning as I was going along. And I had no idea what it meant to be a leader or to lead. But I was trying my best to not just lead myself, but trying to lead volunteers and other organizations that I was working with. So I think that wasn't just a pivotal point in terms of the work that I was doing, but also in terms of my own journey. Gave me the confidence and felt empowered that actually, hey, there's something here. I can do something more than I originally set out to do.
And talking about some of those stats you mentioned, along this journey, you're learning not just how prevalent this is for yourself, but how prevalent this is for others. Talk to us about some of that, whether it's the mental health challenges, suicide, ideation, and attempts. How prevalent are some of these challenges, and what is working to help people go through them?
It's so prevalent. And I think it really opened my eyes to the fact that for the longest time, I felt like I was alone and there was something wrong with me, which was why I was feeling that way. But when you see that data and you think, it's just it can be anyone, it can be any one of us. I think there was something at the time around 1 in 4 young people experiencing mental health challenges, I think by the age of 14. That was by the World Health Organization. That's what I remember it to be. But even just the phrase 1 in 4, I was like, wow, if I'm in a classroom full of 30 of us, that's a lot of us. And I was thinking that I was the only one in the entire school. So it was validating, and it was a relief, but it was also scary, because it was like, wow, so many of us are impacted by this, but we're not talking about it. We're not doing anything. If I've been turned away and told to speak to my GP and call 111, how many other people have been told to do that? And then when I started to look at suicide statistics, that was really, really difficult. I think it's 700,000 people die by suicide a year around the world. In the UK, I think it's one every 16 minutes is what I want to say. Or it's 16 people die by suicide a day in the UK. Don't quote me on that, though.
Okay. I wouldn't be surprised, but that is actually huge. Every day is a huge number.
But the main thing to take away from this is that people die by suicide every day around the world. And I don't think it matters about how many, because even just one is too many in my mind. So I think for me that was really difficult. And I think oftentimes you have this perception, especially when you're sharing something so close to you, that once again, what are other people going to think? Well, this might not be something that's relevant to them. They might think it's weird. But actually realizing that this touches every person in a different way, whether they've directly experienced it or they know someone or they've heard of it, they've seen it somewhere. it's something that's shared.
Well, you know what we're talking about here really is courage. I think the word confidence gets thrown around a lot, but actually maybe a more appropriate word is courage, the courage to be able to be honest. While because you need to be aware of yourself, right? It isn't necessarily an invitation to tell the whole world, especially if you're not comfortable talking about what you're going through. However, there's a sense of if one has done some of the work as you and I have, to be able to talk about as much of it with as much courage as possible, because you never know who is going to resonate and who is going to feel a little bit better that they're not alone, right? Like that stat of you and that realization that you were definitely, just statistically, not the only one in your class going through something. And what if they had also realized that, and you had both realized that at the time? Maybe that would have done something or had some impact, and you never know. But that begs the question: is how do you build up that courage? Because it's so personal.
Yeah, and I think the one thing I always say is like, not everyone has to share their lived experience, especially not in the way that I've done it. And that's okay. You know, some of us choose to go down the path where we build the courage to say it publicly, to talk about it openly, like the way we're talking about it right now, to share it on social media. But not everyone does, and that's completely okay. And I think it's understanding what that courage looks like for you. So once again, is that courage having the courage with yourself to accept it, acknowledge it, be kind to yourself? Is that courage thinking around then learning about what you've learned and supporting other people? Does it shape your interactions and your behaviors with other people in this sense? So I think, once again, lived experience is so personal, and the way that you choose to use that is so unique. There's no right or wrong way to do it.
If these are the challenges of the general population, because I was going to jump in fact, let me what am I really trying to say here? So I was gonna jump in with stats that I know off the top of my head, like in the US, and actually the UK might be the same. Suicide is the biggest killer of men under a certain age, and it's rising in terms of leading cause of death for younger women as well, I think, and a bunch of these other things. And it's like, but actually, you make a really good point, which is that, you know, even one is too much. And there's a reason that despite those stats and despite the moral fact that the stats almost don't matter that much, of course they matter, but even one is too many, despite the weight of both, this goes ignored. It's scary. I think in the UK specifically, we have a mindset of if we talk about it, it's going to make it more likely, which is a myth I've heard a lot, but I think we've been able to dispel it a bit as a myth. But just in case, talk to us a bit about that. Like, what is your understanding of this myth that talking about suicide will push someone to be more likely to suicide? Where does that come from, and what is the reality?
I think it comes from a misconception that talking about it is the wrong thing to do. And I think also, I would like to speculate that actually it's a way for people to avoid having to have that conversation because they don't feel comfortable with it. And obviously that myth is not true at all. And I completed a assisted suicide intervention training skills certification course. It was really, really interesting talking about suicide intervention. And the thing that they kept reiterating was that actually talking about it can help save a life. Because when you talk about it, you're giving permission for people to share how they're feeling. Imagine you're dealing with suicidal ideation and you're stuck because you feel like you can't speak about it. This is the only way. You have to keep it within yourself because you're not allowed to speak about it. But actually talking about it with someone gives them the permission to think, actually, this is how I'm feeling and I feel like I can talk about it and then get the support that I need. But I think a lot of it roots into the fact that people just don't want to speak about it. In the same way that, for example, like a lot of people don't want to talk about like death in general, even though we know death is inevitable, because they say, oh, just don't speak about it. Then some people say, don't speak about it because, you know, what if it happens? You know, don't want it to happen.
Yeah, you're jinxing it for yourself or whatever.
And I'm like, well, is that more of you just saying it because you just don't want to have the conversation? It feels like it gives you another reason to not have that conversation.
Yeah. It's a logical sounding reason to actually be very dismissive as a result of fear.
Yeah.
That's interesting. And if this is prevalent for the general population as a whole, do you think it's worse for younger people? Do you think we're going through more of this than previous generations have? And if so, why?
So statistically, suicide rates within the age group of 18 to 24 have been increasing. That's a trend that we're seeing. So statistically, answering the question, yes. I think there's generally a bigger conversation that we're having within our younger generation around suicidal ideation, suicide prevention. So I think it feels like it's something that's all of a sudden happening and wasn't happening before. It's that we're more aware about it right now. But I do think that there are a lot of factors in the day-to-day life and the world that we're living in now that are contributing to more frequent instances of mental health issues amongst young people and potentially also suicide cases.
Like what?
I think so COVID, that was a huge one. There is no way that we can just ignore the fact that like as a world we went through this, and especially younger generation during those formational years of your life. We went through that. Completely has changed the course of what the future looks like. There is so much uncertainty in the world, and others would argue, but there's always been uncertainty. Uncertainty is inevitable. But I think this looks slightly different for the younger generation right now. Like, we can't ignore the fact that there is wars going on around the world, genocide, there is economic instability, there is just so many question marks around everything.
And that gives a lot of anxiety, doesn't it?
It does.
We are kind of ignoring it though. Like, we live in an age where we're on to the next thing like that. You know what I mean? Whatever anyone thinks of, like, let's say like Donald Trump, I know, like, fun topic, but whatever anyone thinks, it was the first assassination attempt in a very long time in the US. And the last ones, they were talked about for ages and ages. And now, within 2 weeks, that was over. There's a question of what if he had died? Would it have been different? But we live in a time where things move on like that. If one day we find out statistics around young people young people's mental health is worse, we'll move on pretty quickly. If one day there's a school shooting in the US, or even here, we've actually had a big increase of violent crime here in the UK. I feel like I'm getting stuff all the time on my phone about it. We never talk about them. We move on from things so fast because we're in an age of there's constantly something new. The news isn't news anymore, it's clickbait. And I can't help but wonder if that is not only... I feel like this is doing two different things to exacerbate these mental health challenges. One is it's not giving us time to process things that affect us, and we're used to just, this hurts, so I'm going to ignore it by mindlessly scrolling on social media or whatever. And then number two, it means that there's a constant stream of new stuff. So we're never processing, mourning, if that's what we need to do, or anything like that. And we're also getting a constant wave of new crap. And as a result, the brain is just overwhelmed with negativity that it has not processed. And so negativity becomes the norm. And what's the result of that naturally going to be?
Yeah. I think there's also just this societal attitude now that, well, there's so many things wrong in the world. Like, it's just another thing. We've become complacent to an extent. Like you said, like, we see the news about something and people maybe in the moment think, oh, I feel really bad for them. But they just they feel more connected than ever, but they also feel so much more far removed from things. And I'm struggling to grapple with it myself as well, is that, what do we do? Like, what do you do? Like, yes, you can acknowledge that there is so many things wrong in this world and there are so many things that we want to fix. And in the ideal world, we would fix them and there wouldn't be anything wrong in the world. And then I think, especially for a younger generation, there's that element of this thing fuels my passion. I feel extremely passionate about it. I feel emotionally charged. But what can I do about it? I don't have the resources. I don't know how to do anything about it, especially these larger scale problems that we're speaking about. As one individual, you think, what can I do? And that feeling of hopelessness, helplessness, I think is definitely prevalent. And then to add the layer of the fact that we live in a world where success is now defined to us through social media, it feels like there are infinite paths for us to go down as individuals. The disparity, especially between people, whether that's from a socioeconomic perspective or from a different opportunities, has grown. So I think you almost feel like you're conditioned to have to think about the next thing because you're constantly needing to just level up and just keep on doing these things. And as a young person, you think, well, where do I fit in all of this? What's my path? What's my purpose? What fuels me? What do I want to do? How do I make money, but then chase the things that are important to me?
I'm going to do that annoying thing where I ask the question back to you. What do you think we can do about it? And how should we be trying to navigate these situations and the landscape that we have now?
I think once again, it goes back to it's so different for each and every person.
What can everyone do?
What can everyone? I think for what everyone can do is like understand and define what you feel like your way of contributing. What is your way of making an impact? Define that for yourself. Define that and do that. Sounds very simple, right?
Oh, wow. That's interesting, actually. That's so interesting. It's simple, but not easy.
For me, for example, I've defined that my impact is sharing, being open, sharing my story, and that is me making an impact. Now, I wish it was as easy as that. And of course, there are moments where I want to do more things. But that's then when I start burning out, getting myself caught up in this trap of I'm not doing enough. So defining that and acting on that has been the best way for me to feel fulfilled, that I am fulfilling a purpose. I am making an impact whilst appreciating myself.
It's really important to me that we have this conversation so that as many of the future leaders and aspiring leaders that we have in society, in the world, anywhere and everywhere can get there, can navigate as they're on that journey, and can arrive to that place of being a leader with as much capability as possible. What would your words of inspiration be to aspiring leaders who are maybe going through some of these challenges?
There's no box that you need to fit in to be a leader. I used to think there was a criteria of what makes a leader. You can be a leader in any aspect of life, in any way that you want to be. I think a leader is someone who knows what they want to do and they know how to do that and they do it. And they also inspire and take people along on that journey, encourage them and empower them to do the same thing in terms of define what the impact they want to make is and how they're going to make that. And once again, it sounds so simple, but I think when you actually start complicating things, it's not helpful.
Getting out of your own way a little bit. A lot of the journey you've taken us on and the story that you described were essentially times that you felt lost. Is this how you overcame it, or are there any details that were missing?
I wouldn't say I overcame it. I'm still lost.
Oh, interesting. Talk to me about that.
I mean, I was saying to you just before we started recording, like I've left my corporate consulting job. I'm trying to navigate my way through. There's so many things I want to do. I don't know how to position myself. I don't know what areas I want to focus on. All I know is I want to do all these things. So I still am lost. I'm still finding my way. But the thing that I think is different from when I felt lost before versus when I feel lost now is that I've grounded myself by understanding and defining what my values are. And that was something for the longest time. I didn't know what my values were. I only realized what my values were this year. I went through a process of actually really taking the time to write these down and having a working document that I have to refer back to think these are my values. Because for the longest time, my values were other people's values. My values are what I think society should think my values are. And going through that, that's kept me grounded. That means that although I don't know how I'm going to get to where I don't even know where I want to get to. I don't know how I'm going to get there. All I know is that I want to make a positive impact. And that's one of my values. So as long as I'm sticking to my values, I'm making decisions on a day-to-day basis that align with my values and make me feel good, I'm sure I will inevitably find the destination or the journey that I need to be on. And I'm just trying to go with the flow a little bit, which is much easier said than done. But actually, when I was trying to not go with the flow, I was trying to go against the flow, that was really bad for my mental health. Because once again, I was trying to have that control and I just couldn't have that control. And that I felt really difficult.
Yeah, control is usually, not always, but is usually going to be an illusion. There is much that we can influence, but very little we can actually fully control, because so much of what influences everything about us and our lives is actually outside of our control. What went onto that like document of your values? What did you write down? What are your values?
It's literally 2 pages on a Google Docs. It's
Oh, okay.
nothing
So it's
extensive.
okay. You say 2 pages. That's a lot of writing. I was
The
like, that's
text is
really
really
long.
big.
Oh, I see. Okay.
I've got headers and everything. So I think the first thing I put is like, what makes me feel happy? What makes me feel content? And it was thinking around things like making an impact, connecting with people, helping people feel heard and seen. All of those things are what makes me feel happy and content. Doing things that allow me to put my well-being at the forefront. So all of these things. And then I asked myself, what is it that doesn't make me feel happy, with examples. So I then started to write down examples in my life where I felt really out of alignment with what I'm doing. For example, my corporate job. I knew I didn't want to do that, but I felt like I should do it. And the impact that that had on my physical, my mental health was really apparent. And for me, writing that down and really taking the time to reflect and understand how that made me feel in a negative way reinforced the previous points about what makes me happy. And then what I did was from that listed a bunch of questions. So I think it was 5 questions that I would want to ask myself when it comes to making decisions or if I'm questioning if something aligns with my values. And then the questions are something along the lines of like, how do I feel about this? If this makes me feel happy, does it align with those first initial bullet points I put? If it's not making me feel happy, does it resonate with any of these examples that I've listed of times where I didn't feel good with what I was doing? And then dependent on those answers, it's like, what is it that is encouraging me or prompting me to do this or make this decision or behave in this way? And moving forward, what is it that I feel like is the right thing for me to stay aligned to my values? So it is really, really basic stuff, but that's what works for me because oftentimes I do a lot of the thinking in my mind. And then what happens is because I'm doing a lot of thinking in my mind, I get so caught up in my own thoughts that I don't do anything about it. So for me, having it written down makes all the difference because now I have a reference point. I have to go back and refer it. There's no excuse.
Do you actually reread it? I'm really bad at rereading the things I wrote to keep myself on track. Do you know what I mean?
Yeah, I used to be really bad at it, but I've tried to build up the habit of, I check it at the end of every month. So I do a reflection at the end of every month. A separate reflection I do is I list out all the achievements and wins for the month. Because what would happen is that I would end the year and everyone would say, how did the year go? And I'd say, oh, I didn't really do much, didn't really achieve much, didn't really do anything that made me happy. So I do that at the end of every month. And then what I also do is revisit that document. So just to remind myself to have a look at it once in a while.
I wonder if so much more of our generation going through these challenges is going to create a generation that shows up very differently when more of us are in those leadership positions or are more of the leader that we can be. And that can be everything from a leadership role at a company to running a business to being a parent. Everywhere that being a leader, that one is a leader and that leadership shows up is inevitably shaped by our experiences. So many of us are going through mental health challenges that generations before either haven't gone through as much of, or it just manifested very differently if it was. How do you think that our generation will show up as leaders, having gone through these almost generational challenges of more comparison mindset, more suicidal ideation, but etc., but also more awareness of these things? How do you think that's going to affect us as leaders?
I think us as leaders will be more empathetic leaders. We'll lead with empathy. have that agility and flexibility. And I think we'll break away from that box of what a stereotypical leader looks like and what makes someone a stereotypical leader. I think oftentimes we've been fed the narrative that you need to climb up a ladder till you reach to a certain point, and that's when you're classified a leader. But I think we're completely changing that. You know, you can be a leader in all aspects of life in different ways, and also acknowledging that as a leader, you have areas that you have strengths in, and then you have areas that you have weaknesses in. Because I think, especially when I was younger, I used to think like leaders are just all-rounded perfect individuals, like they just have everything together. But I think leading in with the areas where you have that expertise, experience, and strength versus trying to show up and be perfect at everything and be able to do everything. I think leadership is going to be very different for our generation.
Hey everyone, I hope you've enjoyed the show so far. I just wanted to take one quick sec to ask you for a huge favor. If you've been appreciating the show, the guests, the lessons, the journey we've been on, then the best way you can help out to help me and help everybody else listening to this is to subscribe to the show wherever you are. YouTube, Spotify, or wherever else you're watching the show, hit the subscribe or follow or whatever other button and all the bells and icons, whatever else you're happy to keep up to date with the show, hear about new episodes as soon as they launch, and help us to grow and reach more people. I know you've heard this before, but it's because it really does help. It really would help out and makes the world of difference to me. So thank you in advance. And honestly, I really appreciate you. And one final quick note here. I wanted to draw your attention to my free weekly newsletter discussing a variety of topics to do with leadership development and discovery over on Substack. I'm always so humbled by all of the kind words of support I've received over the years from people reading my newsletters about how interesting or helpful that they've been. So if you want that extra hit of thought-provoking conversation once a week, then you can find that in the show notes down below. Thank you so much. I really appreciate it. And let's get it.
We started this conversation, maybe even before we technically started recording, talking about perfection. Yeah. And as you mentioned, this is actually kind of something you're going through yourself at the moment, but what are your current thoughts or reflections about dealing with perfectionism? Reflecting on this conversation is very sobering because we all go through challenges, and you say you're still doing some searching yourself, and I'd probably argue we all are. I love to say that it's all an evolving journey of discovery, and that's actually a good thing, because life would be so boring if it wasn't. So there's always some level of which we're still doing, some exploring. Otherwise, life gets a bit stale. And so one of the things I think is interesting to reflect on is, if that's the case, perfection can't exist, and that's a good thing. So what is your relationship with perfectionism now, and what do you think the answer, if there is one, is to dealing with that?
So my relationship with perfectionism at the moment is understanding, what is this image that I've created of perfectionism? How do I define it? How have I been defining it? And what is driving this desire, this desperation for perfectionism? For me, it goes back down to, I had aligned it with worth and value. So that's why I was searching for this thing. And when I was thinking about what perfectionism meant for me, it meant people pleasing. It meant meeting everyone else's expectations. And I've been on this own journey of figuring out that that's never going to make me happy. It's a useless goal to have, because I'm never going to fulfill it. So at the moment where I'm at with perfectionism is trying my best to redefine exactly what perfectionism means to me. And this is slightly different to what I know other people say, just forget about perfectionism, don't chase it. For me, perfectionism is around how I feel when I do things, rather than the outcome or the process of doing them. So before, when I was thinking about perfectionism, I was focused on achieving a perfect outcome, right? Doing things in a perfect way, then having a perfect reception to those. In my mind now, perfectionism is just around how I feel within me. So do I feel happy? Do I feel content? Do I feel aligned? For me, that's the perfectionism I'm trying to achieve when I'm doing something or making a decision, rather than waiting for an outcome and seeing how that's then going to be perceived. So, because I think for me, saying, "Oh, just don't chase perfectionism," that's not going to work for me. I need to redefine it and use it in a slightly different way, because I find that it would be too big of a step to think that, oh, perfectionism doesn't exist, just forget about it, because that's is in me. I can't just forget about it. I just have to work with it in a different way.
I wonder if there's a different word to use then. Like, what do you think? Is there one? Like, what does your reframe currently look like? Where have you gotten to so far?
Still early stages. So my
Okay.
reframe currently is trying to work out, what does that feeling look like on a day-to-day basis when I'm making those decisions. And then I think I'll get to a point where something comes to me and I'm like, this is better placed than the word perfectionism. Because also I had a similar journey with the word discipline and understanding what so I've kind of been trying to wrap up that reframing of discipline. So I'm going to try and apply a similar model there, because with discipline, for example, I thought discipline meant being rigid, having a routine, doing things in a very set way. And I would be so annoyed at myself if I just couldn't keep up with things. But then I understood, actually discipline for me, once again, is keeping aligned consistently to my values. And for me, discipline was making sure that no matter what I do, my well-being comes first. So actually discipline didn't feel like this scary thing where I had to wake up at 5 a.m. and go to the gym and then start my day. It doesn't feel like that anymore. Discipline just feels like something actually that's very just like tied into everything I do now.
That's interesting. Because words are just ways of expressing concepts.
Yeah.
The word is not the thing. The map is not the territory. And so how we use language for ourselves defines sometimes, to some extent, what our reality looks like. This has been really interesting. It's taken us into a few different directions. There's a sense that I get from this conversation that there's an element of being in more specific near-term discovery of what's next for you and who you show up as being in that position or in that experience. Who would you say you aspire to be and why?
I aspire to be the person that I wanted to be when I was younger. And when I say younger, I don't mean the age where I wanted to be a lawyer or anything like that, because that wasn't my dream. That was a dream that I was fed. I want to go back to the point where I can't pinpoint an age, but I just remember just feeling this like excitement for life. Feeling like excited that, oh, one day I'll be able to live a life where I wake up and I do something that I love. That was before I got to the point where I started to attach career paths with what makes me happy. All I knew is that there's an anticipation when you're younger of, when I can become an adult, I'm going to be able to do all of these things. So when I say who I want to be, I just want to be that. I want to be embodying that feeling, that kind of like very blurry figure that I had in my mind when I was younger, before I started to practically think about what that looks like. Because once I started to practically think what that looks like, that the essence of that got lost. That's who I want to be. I want to be someone who feels fulfilled and happy in what they're doing, aligns with their values, is making a positive impact and helping other people. Because then I go back to my philosophical self, where I look outside the window and I'm like, well, what else am I here to do?
Yeah.
I'm not here to just make money.
I love that position though, and being in that place, because it's one that is full of discovery and curiosity, and that allows us to play and learn and explore and be okay with not having all the answers. And that is the essence of doing the searching and being on that journey. I think it's actually a really freeing place to be when you can admit that being there is okay. I think it's scary if you have the framing that you always need to know and be in control. But it's really energizing listening to you go like, yeah, I realize I don't have all of the answers. Because guess what? No one does. we need some of that courage to admit it. And I think that's a good thing. As we start to wrap up this conversation, do you have any words of, I guess, like teaching, anything that you want people who are currently in leadership roles or showing up as a leader in some way, or just in influential positions in general, to understand about the work that you do in and around the work that you do. So understanding things to do with mental health or other challenges that folks might have, such as some of the chronic illness that you have. Any words of anything that you want them to learn or understand to better support the people that they are leading or influencing?
Yeah, so I think everyone is an expert in their own experience. You can only speak about what you've truly experienced. You can obviously speak about the things that you studied, but you're only ever a true expert in your own experience. And I think the thing with leaders, anyone in influential positions, is they have the opportunity, resources, and privilege to be able to make space for other experts by experience. And one thing I would love to see is that leaders create spaces, opportunities for people to share their lived experience, because the only way we're going to ever truly make an impact for everyone, by everyone I mean every single person, not just a select group of people which mirror the experience of that leader or is within the realm of kind of what they know in that space, is to truly make space and opportunities for that lived experience, sharing, telling, allowing as many voices to be seen and heard. And I think that's also where the younger generation is going to change their leadership style, is making space for everyone, which I think is what we're still missing at the moment.
Yeah. But that's where the space to play starts a little bit, right? And through that we explore the best solutions together. We don't need to have all the answers right now. You've kind of answered this, but I'm going to ask it anyway because I have a closing question I like to ask everybody on the show. The show is called Lost and Searching. So, Tanya, I'd love to know, are there any answers in life that you are still searching for?
Good question. I think the answers that I'm truly searching for continue to be what fulfills me and what is it that I want to be doing. And the reason why I say that I'm still searching for that is because I know that that's always going to change. What I learned about myself last year is different to what I'm learning about myself this year. And I think the excitement for me comes from the fact that next year I'll be learning something new about myself. Like, these answers are dynamic. They're never going to be set in stone. So I think the answers that I've been searching for, have searched for, I'm going to continue searching for those.
Everything flows and nothing abides. Everything gives way and nothing stays fixed. That's a quote from Heraclitus, I think is how you pronounce his name, which is one of the many Greek philosophers. And it's this idea that every time you, I guess, is the kind of the concept that every answer you find, a new question may arise.
Yes.
And that's actually okay. Because again, like, wouldn't life be stagnant? So much of this conversation has made me reflect on the fact that often we get in our own way, and that isn't our fault. It isn't to place blame on ourselves or judgment on ourselves, not being annoyed at yourself for something you can't control, like you described earlier, right? There's no point in being angry at your body for doing what it's doing. Take as much influence and as much responsibility as you can, and that's it. It's reminds me of a Nepalese proverb I learned. I lived in Nepal for a little while when I was younger. They have a proverb that goes, if there is no enemy within, there can be no enemy without. And I think that kind of summarizes our conversation today. That no matter what's going on in your head, your mind, your heart, your body, to work on that is to allow life, is to create a life that starts to also change. And there's a hermetic saying that goes, as within, so without, right? No matter what challenges are there, the kind of influence that someone like yourself has taken over their lives is so inspirational, because the outer reality starts to morph and bend around that, as opposed to just letting shit happen to you that you don't want to happen. So thank you so much for sharing all that with us in a lot of detail. I really appreciate you coming on the show. It's fairly early days, and so having folks like yourself come on the show, give us your time, but also for yourself in particular, being so honest and open and vulnerable, and sharing so much with us means a lot. So thank you very much.
No, thank you. Thank you so much for having me. And thank you for delving really deep into this conversation, because I do a lot of the sharing, but not from this angle. So I've actually really, really enjoyed it. Thank you.
I'm really glad. That's the point. That's why these are so long. Tanya, thank you so much.
Thank you.